So what to do for youth with aggression as part of their ADHD, but not with bipolar. So this is aggressive. So you've done your diagnosis, and you say, you know what, I got good news for you, it's not bipolar. I got bad news for you, it's not bipolar. So we're gonna deal with ADHD and a very kind of aggressive kid. This was an interesting study that was done with risperidone. And what they did is, for the first 3 weeks, you see that curve coming down, those lines coming down? They did just parent training, and then they put them on stimulants. So aggressivity with ADHD. And then those kids who were not doing well got randomized to either risperidone or placebo. And what you see is the group that were put on placebo kind of leveled off. And those kids who were on risperidone actually got better. So risperidone was effective, but just stimulants plus parent training, look at how much improvement there was up to week 3. It actually was good. And they were in kids with aggression plus ADHD. Not bipolar disorder, but aggression plus ADHD. So it's like, ugh, okay, that's one study. I'm not sure I'm gonna do that in clinical practice because of one study, but here's another study. And notice the dates, we're getting more contemporary. This is 21. And this was 175 children. 151 were put on stimulants plus parent training. And then they were gonna do this fancy study where they randomized those kids who still had symptoms to risperidone, divalproex, or placebo. And what they found out of that 151 is only 45 met criteria for needing more treatment. 100 of that group got better with just parent training and stimulants.